Have you ever stopped for a moment and questioned why your erections don't feel as firm as they used to, even when everything else seems normal? Most men immediately assume it's testosterone dropping or blood flow slowing down with age. That's the common belief. But medically, that's only part of the story. There is a hidden system inside your body that most men completely ignore, and it plays a much bigger role than people realize. I'm talking about your pelvic floor muscles. These are not visible muscles. You don't see them in the mirror, you don't think about them in daily life, but their job is extremely important. They act like a natural support system that helps trap blood inside the penis during an erection, keeping it firm and stable. When these muscles are strong, they help maintain rigidity with better control. But when they weaken, the ability to hold that pressure inside the penis also decreases. And just like any other muscle in the body, they don't stay strong automatically. If you don't use them, you lose them. With age, inactivity, and long sitting hours, these muscles gradually become weaker without most men even noticing it. And this is exactly where the real problem begins. Because it's not always about less blood flow. Sometimes it's about not being able to hold what's already there. Now here's something most people misunderstand. Pelvic floor training is often associated only with women. But in clinical practice, that assumption is completely outdated. I've seen men in their 50s, 60s, and even 70s completely change their sexual performance simply by rebuilding strength in these hidden muscles. Not through medication alone, but through targeted muscle activation and control. That's why today, I'm going to walk you through 5 of the most effective Kegel-based movements you can do at home. No equipment, no complicated setup, just body awareness and consistency. These exercises are designed to support firmer erections, better control, and improved bladder health as well. Because these systems are all connected. And if you stay with me until the end, you'll notice something important. The final movement is the one most men completely skip, but clinically, it's often the one that creates the most noticeable improvement in long-term firmness and control. Now, let's begin with the first foundational movement that sets everything in motion. Lie down comfortably on your back. Bend your knees at about a 4-5 degree angle. Keep your feet flat on the floor, hip width apart, so your body feels stable and balanced. Place your arms gently at your sides. Palms facing down, just allowing your body to feel supported and relaxed. At this point, don't rush anything. Just let your breathing settle naturally. Slow, steady, and controlled. Now bring your attention to your lower abdominal region. Gently tighten your core muscles. Think of drawing your belly button inward toward your spine. At the same time, press your lower back lightly into the floor, reducing any natural arch beneath it. You should feel your pelvis slightly tilting upward as your muscles engage. Not forcefully, but in a controlled, intentional way. There should be no strain, only awareness. Now hold this position for about 3 to 5 seconds. Keep breathing slowly through your nose. Then release everything with control and return to the starting position. What looks like a simple movement on the outside is actually highly significant internally. Because here, you are activating not just one muscle group, but a coordinated system. Your lower abs and pelvic floor begin working together in what specialists call co-contraction. This is the same muscular synergy involved in maintaining erections. These are the muscles that contract rhythmically during arousal and help lock blood inside the penis naturally. Think of them like a built-in support ring. When they are strong and responsive, they help maintain firmness more effectively. But when they are weak, that support system becomes less reliable. Over time, practicing this movement daily trains your body to regain control over this coordination. Not by guessing, but by learning exactly how to activate these muscles on command. There is also another important benefit here that most men overlook. It builds what we call body awareness, or more specifically, proprioception. This is your brain's ability to recognize and control internal muscle activity. Many men don't even know how to consciously engage their pelvic floor until they start practicing this type of movement regularly. It feels unfamiliar at first, almost like discovering a muscle you never knew existed. But over time, control improves significantly. You begin to understand exactly where these muscles are and how to activate them intentionally when needed. This improved awareness can lead to stronger, more reliable erections, better control during intimacy, and even improved bladder function with reduced urgency. Start with 10 to 15 controlled repetitions. Focus on quality, not quantity. Slow execution matters far more than speed or volume. As your strength improves over the coming weeks, you can gradually increase to 20 or even 25 repetitions. But consistency is the real key here, because over time, you'll begin to notice a very real shift. It feels less like trying to hold and more like naturally maintaining firmness. And that is where real control begins. Now that your body has learned how to activate the foundation of pelvic control through the first movement, we move into the next stage where strength begins to combine with flexibility and internal coordination in a much more dynamic way. This is where real functional improvement starts to develop, because it is not just about isolating one muscle anymore, but about training how different systems inside your body work together under controlled tension and release. The next movement is called the prone stretch, and it introduces a completely different body position that challenges your core, pelvis, and lower spine in a coordinated manner. To begin, you lie face down on a comfortable surface, such as a mat or soft floor, keeping your legs fully extended behind you. Your elbows are placed directly under your shoulders, similar to a very gentle preparatory position for a cobra-like posture, but without forcing any deep arch or strain. Your forearms stay grounded, parallel to each other, providing a stable base of support. From here, you slightly lift your chest just enough to create space between your upper body and the floor while keeping your neck neutral and relaxed. Your gaze should remain forward or slightly downward to avoid unnecessary tension in the cervical region. At this stage, the goal is not height or intensity, but alignment and control. Once you are stable in this position, the focus shifts inward again. You gently engage your abdominal region by drawing your belly button inward toward your spine, as if you are trying to create internal space between your stomach and the floor. At the same time, you lightly activate your pelvic floor muscles, using the same controlled sensation of lifting and holding that is associated with stopping urine flow. However, this should never be forceful or rigid. It is a subtle internal contraction, not a strain-based effort. The combination of these two actions creates a synchronized activation between your deep core muscles and pelvic floor system, which is essential for functional stability. What makes this position especially important is the balance it creates between stretch and activation. While your abdominal region is gently engaged, the front side of your body, including the hip flexors, is being lengthened. These muscles often become tight due to long hours of sitting, which is extremely common in modern lifestyles. At the same time, your deeper stabilizing muscles, including the transverse abdominis and pelvic floor, are required to work in coordination. This combination trains your body not just for strength, but for endurance and control under extended tension. From a physiological perspective, this type of training improves neuromuscular communication. In simpler terms, it enhances the way your brain sends signals to your pelvic region and how efficiently those muscles respond. Many men who consistently practice this movement begin to notice a gradual improvement in posture, especially in the lower back area, because the supporting core muscles become more active and balanced. There is also often a noticeable reduction in stiffness across the hips and lower spine, which indirectly supports better pelvic circulation and function. In the context of sexual health, this coordination becomes extremely relevant. When the pelvic floor and core muscles are trained to work together efficiently, the body develops a more stable internal environment for maintaining erections. Blood flow becomes more controlled, and muscular response becomes more predictable. This is not about instant results, but about long-term functional improvement built through repetition and awareness. You should hold this position for approximately 20 to 30 seconds in the beginning. During this time, breathing must remain slow, steady, and controlled through the diaphragm. Many people make the mistake of holding their breath, but that actually reduces the effectiveness of the exercise. Oxygen flow is essential for both muscle endurance and nervous system regulation. After each hold, gently release and rest for a few seconds before repeating. Over time, you can gradually extend the hold duration to 45 seconds or even up to 1 minute as your strength and control improve. As this movement becomes more familiar, something important begins to change internally. You start developing a clearer awareness of your pelvic region, not as an isolated muscle group, but as part of a coordinated system connected to your breathing, posture, and core stability. This is what makes the prone stretch so valuable in a rehabilitation or strengthening routine. It builds awareness first, and strength follows naturally. Now we transition into the third movement, which is the kneeling abdominal engagement exercise. This position shifts your body onto all fours, creating a stable tabletop alignment. Your hands are placed directly under your shoulders, with fingers spread wide for balance, while your knees align under your hips. Your spine remains neutral, meaning it is neither overly arched nor rounded, but naturally straight and supported. This position alone helps reset spinal alignment and prepares your core for controlled activation. From this stable base, you begin with a slow and deliberate exhale. As you exhale, you gently draw your belly button inward toward your spine, activating your deep abdominal muscles without creating tension in your shoulders or upper body. At the same time, you engage your pelvic floor muscles using the same controlled lifting sensation practiced earlier. The key here is synchronization. The abdominal contraction and pelvic engagement must occur together in a smooth, coordinated manner, not as separate actions. Hold this controlled contraction for about 3 to 5 seconds while maintaining steady breathing awareness. Then slowly release everything back to a relaxed, neutral position. This repeated cycle trains both muscular endurance and neuromuscular coordination, which are essential for long-term pelvic function. Over time, this exercise strengthens the deep core system that supports spinal stability, pelvic alignment, and internal pressure control. Many men report that as they continue practicing this movement, they begin to experience improved control over pelvic sensations and timing. This is because the brain gradually learns to recognize and regulate these muscles more effectively. Instead of reactive or unconscious responses, the body develops a more controlled and intentional pattern of activation. Start with 10 to 15 repetitions, focusing entirely on slow, precise execution. There is no benefit in speed here. In fact, rushing reduces effectiveness significantly. As your endurance improves, you can gradually increase the hold duration or add slight variations in body weight shifting to activate different stabilizing fibers. At this stage of training, you are no longer just exercising muscles. You are retraining how your entire core and pelvic system communicates internally. And that is where meaningful, long-term improvement begins to develop. As we move deeper into this routine, the focus shifts from isolated control to more functional, full-body coordination. At this stage, the goal is no longer just activating the pelvic floor in simple positions, but training it to respond dynamically while your body is under light load and movement. This is where real-world strength begins to develop, because intimacy is never a static position. It requires stability, endurance, and controlled response, while the body is engaged in multiple directions at once. The next movement is the bridge abduction, and it plays a key role in building both pelvic strength and lower body stability at the same time. To begin, you lie flat on your back on a comfortable surface. Your knees are bent at approximately 90 degrees, and your feet are placed firmly on the ground, about hip-width apart, positioned close enough to allow proper leverage when you lift your hips. Your arms rest gently at your sides with palms facing down for balance. At this point, you take a moment to stabilize your breathing and ensure your spine feels neutral, not overly arched or flattened. Now the movement begins with controlled engagement. You press your heels into the ground and activate your glute muscles. As you do this, you lift your hips upward in a smooth, controlled motion until your body forms a straight line from your shoulders through your hips to your knees. This is your bridge position. It is important here not to rush the lift. The movement should feel deliberate, not explosive, because control is more important than height. Once you are in the bridge position, you maintain stability and begin the abduction phase. This involves gently pushing your knees outward, as if you are trying to spread the floor apart with your legs. Then, with equal control, you bring them back toward the center. This outward and inward movement should remain smooth, slow, and balanced. There should be no jerking or loss of hip alignment during the motion. What makes this exercise particularly effective is the way it integrates multiple muscle systems at the same time. The glute muscles are heavily engaged to maintain hip elevation. The pelvic floor is activated to help stabilize internal pressure and support blood retention in the pelvic region. At the same time, the hip abductors are working to control lateral movement, which contributes to pelvic stability and balance. From a functional perspective, this coordination is extremely important. The pelvis is not an isolated structure. It is part of a complex system that relies on muscle balance to function properly. When these supporting muscles are weak or inactive, the efficiency of blood flow and muscular response in the pelvic region can be reduced. But when they are trained together, they act like a coordinated support system, improving stability and control under pressure. This movement also introduces a form of dynamic resistance. Unlike earlier exercises that were mostly static holds or slow contractions, here the body must maintain strength while actively moving. This is similar to real-life physical demands, where control is required during motion rather than stillness. Over time, this translates into better endurance and more reliable muscular response in functional situations. Another important benefit of the bridge abduction is its effect on circulation. By lifting the hips and engaging large muscle groups like the glutes, you are encouraging improved blood flow through the pelvic region. At the same time, the activation of smaller, stabilizing muscles helps maintain that circulation under controlled tension. This combination is what supports more consistent and sustained physical performance. You should begin with 8 to 10 repetitions, holding each outward knee push for about 2 to 3 seconds before returning to the center. The emphasis should always remain on controlled movement rather than speed or repetition count. Your core should remain engaged throughout the entire exercise to prevent unnecessary strain on the lower back. As your strength improves over time, you can increase the number of repetitions to 15 or 20. You may also introduce light resistance, such as a band placed above the knees, to further challenge the stabilizing muscles and improve activation quality. However, progression should always be gradual and based on control, not force. Men who consistently perform this exercise often notice a broader set of improvements beyond just pelvic function. There is typically better hip mobility, reduced stiffness in the lower back, and improved overall body stability. These changes contribute indirectly to better physical endurance and confidence, especially during extended physical activity. Now we move into the final and most often overlooked movement in this entire sequence. This is where flexibility, relaxation, and deep muscular release come together in a way that completes the system. Many men skip this step, but those who include it often report the most noticeable changes in comfort, sensitivity, and control. This final exercise is called the rocking frog stretch. To begin, you position yourself on all fours on a soft surface or mat. From this stable starting point, you slowly widen your knees outward, as far as is comfortable without forcing any strain. Your feet naturally turn outward as your hips begin to open. This creates a wide V-shaped position in your lower body. At this stage, your inner thighs and groin area will begin to feel a deep stretch, which is expected and important. Next, you gradually lower your upper body down onto your forearms, keeping your spine neutral and your head relaxed. This position allows your hips to sink slightly lower toward the ground, increasing the depth of the stretch. You pause here for a moment, allowing your body to adjust and settle into the position while maintaining steady breathing. Once you feel stable, the rocking motion begins. You gently shift your hips forward and backward in a slow, controlled rhythm. This movement should feel fluid, not forced, almost like a wave passing through your pelvis. The key here is consistency and control, not range or speed. What makes this movement unique is its ability to combine deep stretching with dynamic activation. The inner thigh muscles, also known as the adductors, are being lengthened, while the pelvic floor is being gently engaged and released through motion. This creates a balance between tension and relaxation that is essential for healthy pelvic function. When the pelvic muscles become too tight due to inactivity or prolonged sitting, blood flow can become restricted. This can reduce flexibility and affect natural function. On the other hand, when there is a balance between strength and relaxation, the pelvic region becomes more responsive and adaptable. The rocking motion is especially important because it prevents the stretch from becoming static. It introduces movement into the system, which improves circulation and helps the muscles learn how to contract and release in a coordinated way. This rhythm is essential for functional control and long-term comfort. You should spend about 30 to 40 seconds in this position initially, focusing on deep, relaxed breathing. The movement should always feel gentle and controlled. This is not a forced stretch. It is a gradual release. Repeat it 3 times, allowing short rest periods in between sets. As your flexibility improves, the position will feel more natural and less intense. Over time, many men notice improved pelvic comfort, better sensitivity, and increased control during physical activity. Some even report a noticeable improvement in overall responsiveness and sensation, which reflects improved circulation and muscular balance. At this stage, the rocking frog stretch serves as a balancing mechanism. It brings together everything trained in the earlier exercises. It strengthens where needed, releases where necessary, and restores natural flow through the entire pelvic system. As we continue deeper into this routine, it becomes clear that true pelvic strength is not built through one type of movement alone. It is developed through a combination of stability, controlled motion, and the ability to switch between tension and relaxation with precision. At this stage, the body is no longer learning isolated exercises. It is learning a system of coordination that directly supports functional performance in real-life situations. When men begin practicing these movements consistently, one of the most important changes is not immediately visible. It is internal. The nervous system becomes more efficient at communicating with the pelvic region. This means the brain is no longer guessing or relying on weak signals. Instead, it starts to send clear, controlled instructions to the muscles responsible for maintaining firmness and stability. This is where long-term improvement begins to take shape. The exercises we have covered so far have built a foundation of awareness and strength. But the real transformation happens when these movements are performed together consistently, allowing the body to adapt over time. The pelvic floor is not an independent structure. It is deeply connected to the core, hips, lower back, and even breathing patterns. When one part improves, the entire system benefits. Now, at this stage of training, a key concept becomes important: functional control under fatigue. In real-life situations, the body is rarely at rest. It is moving, adjusting, responding, and maintaining stability under varying levels of pressure. That is why these next refinements in movement matter. They help the body maintain control even when it is not perfectly still. Let's return briefly to the bridge abduction, because this is where many men begin to notice a deeper level of engagement over time. As you lift into the bridge position repeatedly, your glutes start to develop endurance, not just strength. This endurance is critical because it supports pelvic stability during prolonged activity. At the same time, your pelvic floor learns to maintain internal pressure control while the hips are actively moving. This combination creates what can be described as dynamic stability, the ability to stay controlled even while in motion. With continued practice, something subtle but important begins to change. The body starts to automatically recruit the right muscles without conscious effort. Instead of thinking about each contraction individually, the system begins to operate more naturally. This is a sign that neuromuscular coordination is improving. At the same time, the hip abductors become more responsive. These muscles play a critical role in maintaining pelvic alignment. When they are weak, the pelvis can lose stability during movement, which indirectly affects overall control. But when they are strong and active, they help support a balanced foundation for the entire lower body. This is why the bridge abduction is not just a strengthening exercise. It is a coordination drill for the entire lower kinetic chain. Now, let's talk about how progression should feel at this stage. Many men expect quick, dramatic changes, but the reality is more gradual and structural. In the beginning, improvements are subtle. Better awareness, slightly improved control, a stronger sense of muscle engagement. But over weeks of consistent practice, these small changes accumulate into noticeable functional improvement. One of the most important signs of progress is reduced mental effort. Movements that once required concentration begin to feel more natural. The pelvic floor becomes easier to activate on command. This indicates that the brain-muscle connection is strengthening. Another key improvement is timing control. Instead of premature or delayed muscular responses, the body begins to respond at the right moment with greater consistency. This is especially important for maintaining control during physical intimacy, where timing and coordination matter as much as strength. At this point, breathing also becomes a major factor. Proper breathing patterns enhance muscle performance significantly. When you exhale during contraction and inhale during release, you create a rhythm that supports both endurance and relaxation. This balance is essential for long-term pelvic health. Without proper breathing coordination, even strong muscles can become inefficient. But when breathing and movement are synchronized, the entire system becomes more stable and responsive. Now we revisit the rocking frog stretch from a deeper perspective. At first, this movement feels like a flexibility exercise, but over time, it becomes much more than that. It starts functioning as a release mechanism for accumulated tension in the pelvic region. Many men carry chronic tightness in the hips and inner thighs without realizing it. This tension can restrict movement and affect overall comfort. By introducing gentle rocking motion, you are not just stretching the muscles, you are retraining them to move between states of tension and relaxation more efficiently. This is extremely important for pelvic function because the body does not operate in a constant state of contraction. It requires flexibility to expand and contract as needed. Without this balance, performance can become limited or inconsistent. With regular practice, the rocking frog stretch helps restore this balance. It improves blood flow, reduces stiffness, and enhances the natural responsiveness of the pelvic region. Over time, this leads to a more relaxed yet controlled state of function. Another subtle but important benefit is sensory awareness. Many men report that they begin to feel more connected to their pelvic region after consistent practice. This is because increased blood flow and improved neuromuscular communication enhance sensory feedback. The body becomes more aware of what is happening internally, which allows for better control. This is not an overnight change. It develops gradually as the nervous system adapts to repeated stimulation and movement patterns. At this stage, consistency becomes the most important factor. Not intensity, not speed, but regular, controlled practice over time. The body responds best to repetition and stability. When these exercises are performed daily, even for a short duration, the cumulative effect becomes significant. Most men underestimate how much change can happen in just a few weeks of consistent effort. But physiologically, the body adapts quickly when given the right stimulus. Improved circulation, better muscle coordination, and stronger neural connections all begin to develop simultaneously. And this is where the real foundation for lasting improvement is built. In the next part, we will move into the final phase of the routine, where all these elements come together into a complete system of control, strength, and functional stability. At this final stage, everything you've done so far starts to connect into a complete system. What began as simple awareness of the pelvic floor has now developed into structured control, coordination, and functional strength that supports real-world performance. This is where the routine stops being just a set of exercises and becomes a long-term method for restoring stability, confidence, and natural control over your body. The key idea to understand here is integration. None of these movements work in isolation when practiced consistently. Instead, they begin to reinforce each other. The pelvic floor becomes more responsive because the core is stronger. The hips become more stable because the glutes are engaged properly. Breathing becomes more efficient because the nervous system is calmer and more regulated. All of these changes support one central outcome: improved pelvic function and better control. One of the most important results men notice over time is improved consistency in erections, not just in firmness, but in reliability. The body begins to maintain internal pressure more effectively because the muscles responsible for support are stronger and better coordinated. This is not about forcing anything. It is about restoring a natural mechanism that was already designed to function this way. Another major improvement is timing control. With regular practice, the nervous system becomes better at regulating response patterns. This means the body is less reactive and more controlled. Instead of rushing or losing control, there is a greater ability to maintain steady function for longer periods. This is directly linked to improved communication between the brain and pelvic muscles. Bladder control is also significantly affected. Because the same pelvic floor muscles are responsible for urinary control, strengthening them improves both daytime control and nighttime stability. Many men notice reduced urgency, fewer interruptions at night, and better overall urinary function. These are often some of the first noticeable changes, even before sexual improvements become fully apparent. Posture and lower back stability also improve as a secondary benefit. The core and pelvic region are deeply connected to spinal alignment. When these muscles are weak, the lower back compensates, often leading to discomfort or stiffness. But when the system is strengthened and balanced, the spine receives better support, reducing strain and improving overall posture. Now, it is important to understand how to apply this routine effectively in daily life. Consistency matters far more than intensity. You do not need long or exhausting sessions. In fact, the most effective approach is short, focused practice done regularly. Just 5 to 10 minutes a day is enough to activate meaningful changes in the body over time. What matters is repetition, not effort overload. Most men see initial improvements within a few weeks. These may include better awareness of muscle control, slightly improved firmness,